Hi, I'm here today to tell you about the Celerion TQT-like trial that we did to test our entire system of our hybrid phase 1 ECG Core Lab. My name is Bill Wheeler, and I'm the cardiovascular lead for Celerion. When we put together this system, we decided that we needed to test the entire system. We ran several previously run TheraQT studies through our system to calibrate it, but we felt because it was a three-part system with a hybrid core lab, a new Holter device with Bluetooth capability, as well as the software, we felt we needed to test the entire system. So we put together a positive control TheraQT-like study. This was a 36-subject, two-way crossover, double-blind, placebo and active control, that active control being moxifloxacin, the standard TheraQT trial active control. Our primary objective was to confirm the combination of both the global instrumentation M12R Holter and the AMPS LLC software suite could identify QT changes when used in the highly automated method. It took approximately 8 hours of cardiologist reading time to review this data. About 11% of ECGs were reviewed by a cardiologist, and only about 2% were changed by the cardiologist. Intra-reader variability was 2.5 milliseconds, and the within-subject variability averaged 5.5 at the peak moxifloxacin effect and 6.5 overall. This study, the Holter monitors came off on a Friday morning, and I actually presented the data, the preliminary data from this trial, the following Tuesday morning. That's very, very rapid. This is the results of the trial. This is the what's known as the double delta. This is the placebo subtracted change in moxifloxacin. It's a pretty standard curve with a peak of effect of about 13 milliseconds, occurring somewhere between 2 and 4 hours, and delaying then over 24 hours. So at 24 hours, it's about a 5 millisecond change. That 5 millisecond change is important for a few things. First, to be adequate, a moxifloxacin study has to have the typical time course and extent, and the lower confidence intervals at the peak should be way above 5 milliseconds, that red line, which it is. At 24 hours, when we're down to 5 milliseconds, the lower confidence interval still exceeds 0. So if we had a study that had a perfect positive control that had a 5 millisecond effect, we would be able to detect that. In addition, if the compound had a 5 millisecond effect, because the upper confidence interval is less than 10, we would be able to exclude that and rule out a positive TheraQT trial. Now this is important because the sample size calculations, which is a major determinant of the cost of your study, is related to variability. This is a pretty standard, relatively simple sample size calculation equation. And this, using the standard setup for a sample size calculation for TheraQT with a delta of about 3 milliseconds between placebo and the drug, an alpha of 0.5 and a 95% power, if you have a 10 millisecond variance, that's going to take 45 subjects. However, if you're down around 6.5 or 7, you're going to be down closer to 20, 22 subjects. That's a major advantage in sample size and cost. We took this data to the FDA IRT, the Interdisciplinary Review team, on June 24th, 2010. They agreed that this was a very typical moxifloxacin effect, which is required of all TheraQT studies. They would accept this data as a moxifloxacin effect. And this is exactly what's required for a study to be deemed adequate. They felt no further testing or validation was necessary. In summary then, we were able to produce acceptable data with no further testing necessary with our hybrid phase 1 ECG Core Lab, which consists of the Core Lab itself, the Bluetooth Holter, and the highly automated ECG processing. Thank you.